Hi everybody, a very warm welcome to the webinar on exercise for a healthy pregnancy and even post-delivery. What I would recommend is this session is going to take about an hour and a little more. So please, maybe you can use the washroom, grab a bottle of water. If you can bring in a notepad and some pen so that you can make some notes if you like along with it, even though the Cordlife team will be sharing the recording with you, your own notes, it will be easy for you to remember and understand as well. If you haven't eaten your breakfast, then remember during pregnancy, it's very, very good to make sure that you eat your breakfast and keep yourself well nourished. So grab a quick snack and get all that ready, and we are going to start in just the next 2 minutes. All right. So welcome moms, and let me start with a very quick introduction of myself. I'm Sonali Shivlani, and I am a pregnancy and post-delivery consultant. So predominantly, I work with families during pregnancy and post-delivery, and I go all the way to child nutrition, breastfeeding, and all of those areas too. I have been doing this since 2004, so I have actually completed 16 years in the profession. On the personal front, I have two children. Mine are much older. My son is going to turn 20 this year. My daughter is going to be 18. So I am actually living with a different breed right now at home. What we have for you today is a session on exercises for a healthy pregnancy. And this session has been brought to you by Cordlife, which is one of India's leading stem cell banks. The session is also in association with Dr. Ratnabali Chakraborty and Dr. Amitoj Athwal. Thank you very much, doctors, for giving us this opportunity to conduct this session for your mothers. And so now all I can say, the way an air hostess will say on the flight, sit back, relax, and enjoy the webinar. All right. So let's get started with this entire discussion today. Just to let you know, we have kept you on mute because it disturbs the presentation. It will also cause noise disturbance for other participants. So if you have any questions, please feel free to put them in the questions section. It's there on your webinar panel as well. And I will make sure that I answer all the questions before we end this session for sure. All right. Thank you very much, and let's get started. So pregnancy is divided into 4 stages. And we call this the first, second, third, and the 4th trimester. And we are going to be discussing all these stages of pregnancy at this point of time. So the first trimester is 0 to 12 weeks. The second trimester is 13 to 27 weeks. The third trimester is 28 to 40 weeks. And the 4th trimester is known as the post-delivery period, which we also consider the 3 months post-delivery. So as you can see, the second trimester is the longest. And the good news is that the second trimester is obviously the most comfortable. So the nausea has settled down, some aches and pains are gone. The belly is still not so big that it is interfering with your activities. Your energy levels are really high. So that's a great trimester in which you can start considering starting off with some exercise routines, etc. The most important thing, and I don't think I can emphasize this enough, before you begin any exercise program, कोई भी exercise program शुरू होने से पहले, you have to ensure that you will always consult your doctor, right? That is very, very important. Make sure that you consult your doctor because only your doctor can tell you what is the pregnancy condition, are you allowed to exercise, is it safe, is it not safe, etc. And I have just been informed that even though the name on the screen is Dr. Amitoj, but it's Dr. Ratnabali who's joined us. Welcome, doctor. Thank you very much for joining us this morning. Thank you very much for giving us the opportunity to conduct this session. Please feel free if you would like to, have a few words with all our listeners and share some tips and advice. We would be really happy to hear from you. All right. So I'm going to just move ahead. So again, to reiterate, before you start any exercise program, always ensure that you consult your doctor. Even though exercise is considered to be healthy, safe, should be done and all of that, it's very important to know your own pregnancy health. There are many times what happens is that, there are certain pregnancy conditions which are not in your control. And it happens because of hormonal changes. It happens because the body is changing, and you may be asked to not exercise. These are a few pointers that I would suggest that you keep in mind. First and foremost, always start slow. Don't be in a rush. Always start really slowly. So for example, if somebody has been exercising regularly before pregnancy and you're used to certain postures and you're comfortable with certain postures and you have the green signal from your doctor, then you can go ahead and start those postures in the pregnancy period also. However, always remember to do it slowly. During pregnancy, what happens? There are hormonal changes which relax our ligaments, which relax our bones. And because of that, if we do any jerky movements, if we do any vigorous movements, it can cause injuries. And if you don't wait and you don't pause in between your postures, in between your sets, you will probably create a bigger injury. So always start slow. The other thing that you have to keep in mind is that start with less number of counts. Don't start with a bang, right? I mean, so, when someone comes into my pregnancy class also, if another mother is doing, say, 50 squats or 60 squats, the newcomer should not start with that. The newcomer should start with just 8 to 10 because her body needs to get used to it. It's a different thing for her. And most of us during pregnancy are told that in the first 3 months, we don't exercise. So your body muscles are kind of sleeping at that point of time and you have to wake them up. So you can't wake them up with a jerk. Do not start something new unsupervised. It's a good idea to have someone watch you and make sure that you are getting the postures correct. In case you are doing this at home after getting your doctor's permission, maybe you can get your husband to supervise you because while you are doing the exercises, you don't know whether you are doing it correctly or not. It is always better to do less counts. Don't do too many counts. Always do less counts because that is important than having the wrong posture. Yeah, so better to do this rather than do a incorrect posture. If you feel any discomfort, please stop. Don't be in a rush. Don't be in a hurry that you have to finish that, okay, normally I do 45 minutes, so I must finish my 45 minutes. It is not like that. If you notice any of the warning signs, which I'm going to be sharing with you shortly, make sure that you stop. Don't be, I have to complete my routine and then I'll go to the doctor later. It doesn't work that way. So always be really, really careful before you start off all your exercises. Keep these things in mind. These are some of the warning signs that you have to watch for. The first thing is abdominal cramps. When you have abdominal cramps, that can create a challenge in terms of, you may be having preterm contractions. It may be early labor. It could be something which is kind of, triggering off some issues inside your body. So it is better that you stop if you're getting period-like cramps in the abdomen, which are rhythmic, which have a pattern. If you can see any kind of leaking, that means water discharge from the vaginal area, then that is also something that you have to watch out for. If your vaginal discharge increases, so during pregnancy, it's very normal to have a lot of vaginal discharge more as compared to pre-pregnancy. And this discharge is generally milky white, it's a little sticky, and this is considered normal. But if it's a lot and you're kind of starting to feel damp because of your vaginal discharge, then that is a sign that you should inform your doctor. If there is any kind of vaginal bleeding, so bleeding is like an always big alarm sign as far as your pregnancy is concerned. So any kind of bleeding should be reported immediately to the doctor. Any other abnormal signs, so if you're feeling uncomfortable, if you're feeling breathless, if you're feeling some kind of other discomfort, anything which does not feel ordinary should be informed and reported. So you should stop your exercise, check with the doctor, and then continue. These are some of the myths that are there around exercise. The first, exercise will cause a miscarriage. That is absolutely not true. So I will try and explain what happens. Okay. So take a look at this. This is your pelvis. And this is the part of your body, the lower body, which also makes up your hips. This is your tailbone. This is your hip area. So this is your pelvis. Now, during pregnancy, there are two factors which are going to work. One is the pelvis, and the other is the mouth of the uterus, which is called the cervix. Okay. So when I'm doing exercises, I'm actually moving the pelvis. So if I'm doing any kind of leg raises, for example, if I'm doing a squat, this is how the pelvis moves. Please remember, I am not moving the cervix at all. There is no way that the cervix is going to get impacted when you're doing any kind of exercise. So don't worry, exercise is not going to cause a miscarriage. Welcome, doctor. Thank you for joining us this morning. Hi, ma'am. Welcome this morning. Thank you for joining us.
Yeah, thank you very much. Good morning to everybody. Yeah,
now, and I'm going to keep quiet, and she's going to talk to all of you for just a little bit.
Last week I talked for 1 hour full, so I'll be compensating this week. Not be much. What I decided was to talk the two main complaints with which the pregnant woman comes to us. Whenever you ask what is your problem, one of the problems is backache. So we know why the backache occurs, and it will occur. So how to compensate it? For that reason only we have decided to have a webinar, because I'm talking the same thing to everybody. If they listen from an expert like you, how to combat or fight that pain, that will happen to all pregnant women, more or less. So this is a point of discussion today. And related to this is also the second problem. Many a woman will say, I feel a lot of, acidity and heartburn. It burns inside my chest, and some liquid comes up in my mouth, and my throat gets sore. So this is another problem. Both of these are linked. How it is linked? This is my point of discussion for 5 minutes today. When somebody is pregnant, then there are several hormones, chemicals that come out in their body. One of it is a progesterone hormone, which is keeps the pregnancy safe. And this progesterone hormone has got function of relaxing all the muscles and joints in the body. Plus another chemical comes out, that's also a hormone, which is called the relaxin hormone. Relaxin also relaxes the joints, the muscles, the ligaments, everywhere in the body. So these give rise to changes in the body. For example, the woman feels backache. They feel a pain in the lower part of abdomen. They'll say that there is a pain just above the part from where we pass our urine. This is the bone we call symphysis pubis. Actually, there is a girdle sort of thing in our, it looks like this, through which the baby passes out. And our uterus and other, the reproductive system lies within it. So during pregnancy, when this relaxing hormone relaxes the joints, these are all jointed parts, so they become relaxed. They move away from each other. Sometimes when you lie down, you feel like something, ghista hai bolte hai, like like on one bone, the other bone is, it's not smooth. Something is rubbing against one another. So this also causes pain because the joints become subluxed. They are moving. Whenever you're moving, you're sitting in a sofa. When you sit without having any support, your back is not getting support. The bones now rub against each other. So like that, the ligaments also, they become loose. The muscles in the legs, they become loose, so that when you sleep at night, the nerves under pressure, they give pain in the legs, leg muscles, cuff muscles. So all these this will happen. This is natural. But how to combat it, that will be discussed today. And you also understand that those who are sitting over here, majority of them do not have regular physical exercise and household work, the chores that you should have done, you do not do. Because nowadays we have got a lot of makeshift arrangements in our homes. So while we are not doing any exercise, the muscles are not strong, and during pregnancy these hormones come out. They make the muscles and joints more and more relaxed. You will have this pain. So what to do? That Sonali will be discussing. Similar thing happens with there are rubber girders of sort of things on the two ends of your stomach. Stomach is the place where when the food goes and it mixes up like in a mixer machine with the hydrochloric acid that comes out from the stomach, which we call acid. Acid should be there, otherwise the proteins and vitamins, minerals will not be absorbed in our body. For example, calcium, iron, all are absorbed in an acidic medium. So whenever you eat, it goes to the stomach, and this acid mixes up with it. And at that point of time, two rubber girders on two ends of the stomach, which is a bag-like structure, that closes. This is a normal situation. But in pregnancy, like all of the muscles and ligaments, these are also relaxed. So when you take food and the acid goes there, it is churning, mixing up. Some amount of it will come upwards, and you'll feel like the acid coming up in your mouth, in your throat, in the middle part of your chest will burn. We call it heartburn. And this, you feel like you are filled up, you don't feel like eating, you become pukish. All these things happen due to a natural phenomenon. So we advise that you take small amount of food at regular intervals. So instead of taking, two breads in the breakfast, take one bread, give 1 hour time, take some water so that whatever you have eaten goes down, and then take another bread. This sort of thing, because if you eat more acid will be secreted. After churning, more and more fluid will be there in the stomach, and it will be easily coming up through your chest. You get it, that we call the pipe esophagus. So it passes to the center part of the chest, to the throat, to the mouth. So both things happen because of the same reason, and we have to train ourselves during this 10 months period of pregnancy how to combat it, because after you deliver, it again will come back to its natural situation. So I would request Sonali, who is advising, giving her very valuable advice to all the pregnant women, will be helping my patients, the women who are in our clinic, Max Clinic, showing to us, and also some from the neighborhood. So all of them, Sonali will be addressing. Sonali, please, I'm requesting you to address them. Thank you very much.
Thank you, ma'am. Thank you so much for the valuable inputs. I'm so sorry I missed your session last time. But anyways, it was really a pleasure to hear you this time. I'm going to just get my slideshow started again. So we were discussing the myths and etc. of pregnancy and exercising during pregnancy. The second one was that exercise will impact fetal development. So exercise will not allow my baby to grow. Exercise will make my baby smaller. Exercise will not result in weight gain in the baby. All of this is also a myth. Exercise is not going to make you feel exhausted. Maybe, when you start the exercises in the beginning, first few days, you might feel a little more tired, which is why we are asking you to start slowly. But later, as you continue doing the exercises on a regular basis, you will realize that exercise actually makes you feel brighter and more energetic, and all of those advantages will come to you. Exercise will overheat and dehydrate you. No, this is also not true. Of course, there is the very important thing that you should keep in mind, that you wear comfortable clothes and you keep yourself well hydrated by drinking water all throughout. Weightlifting should not be done during pregnancy. That's another myth that a lot of mothers have. So I'm not saying that you have to become a bodybuilder and, do all of those kind of weightlifting things, but small dumbbells or little weight for the upper body can actually be very helpful in building your muscle strength. Exercising on bed rest is not allowed. In a lot of extent, this is true, but it also depends on what the condition is. Sometimes you are asked to lie completely straight. You're not even allowed to visit the bathroom. So in this sense, yes, a lot of movements will be restricted. But in case you're allowed to sit up in bed, then you can start doing something for your neck, for your shoulders, maybe for your chest. All of those can be done, but in moderation, very little bit. It is not important to warm up or cool down. So warm up and cool down is very important as far as any form of exercise is concerned, whether it's pregnancy or not. You should be doing a warm up because it helps to wake up your body, and you should do a cool down because it allows your muscles to come to rest a little bit easier. Don't start with a bang and don't stop with a bang. That is something which is very, very essential. The first thing that I'm going to now talk to you about is the pregnancy posture. And as ma'am correctly said, back pain is one of the biggest complaints that mothers always come to us with. And many times we don't even realize that it is not really anything else, but it is just our posture. So let me explain this to you first using my hand. Okay, so let's imagine that this is a normal person. Even in a normal woman, there is a little bit of a curvature in the lower back right here. Okay, so there's a little curvature in your back. Now, when this woman becomes pregnant, her belly size is increasing. So the weight is increasing in the front over here. To compensate for this increasing weight, the back has to start tilting a little bit like this because the extra weight is over here to support this weight. So this curve that was there now becomes a lot more exaggerated, and this puts a lot of strain on the back. The second thing that also happens is that during pregnancy, your chest size changes. I think that is what you must have realized from the very first day. The chest size changes and the breast weight increases, due to which, to support this extra weight, the shoulders are kind of now pulled down and your body starts drooping. So you may have an exaggerated curve over here and a different curve over here. All of these things are going to put a lot of strain on your spinal cord, and it's going to cause back pain. However, if we are cautious with our posture, all this can be easily avoided. So if you look at my first picture, it is of a woman who's like literally slouching in her chair. And the second picture is of a woman who's sitting up tall and straight. I'll give you a very good tip on how you can do this without giving yourself too much strain. You know the small pillows that you get, which we normally keep in our cars, and sometimes it's only for show. Those small pillows are great to have. You can always tuck it in the small of your back wherever you're sitting so that your back gets that additional support. So keep this in mind. Keep those small pillows around the house. That is very great to correct your sitting posture. Then comes your standing posture. So if you actually look at my picture on the right, it is this thing that I showed you, right? The shoulders are hunching, the spine is curving, the abdomen is protruding, and the buttocks are also protruding. So if the woman decides that, okay, I want to correct my standing posture, just remember these things. Try and stand up tall and erect, push your shoulders back, and kind of stick your chest out. This will automatically correct the curve in your spine, right? So always remember, stand tall and erect, push your shoulders back, and stick your chest out. That is going to help to correct your standing posture. And again, both these small corrections, and it's so simple, right? It's just something that you have to do on a day-to-day basis. Don't slouch, don't slump. It will help to take care of your back pain problems. And then, of course, we come to prenatal and postnatal exercises in the different trimesters. Again, I'm going to remind you, you need to check with your doctor before you start any exercise program. Start slow. Don't be in a rush. There are lots and lots and lots of benefits of exercise to mom. And of course, overall as well. So it will help to ease or prevent back pain and other discomforts. So when we're talking about other discomforts, we're also talking about maybe cramps in the legs. We're talking about, a little bit of swelling, edema, acidity. I think so many things that even ma'am spoke about. Exercise can help you relieve all of that. It can help to boost your mood and energy levels. And it's a very well-known fact that pregnancy brings about hormonal changes. Hormonal changes affect your moods. Pregnant women are irritable and cranky and unreasonable. I mean, I know, no offense to all of you, but maybe your husbands will be able to vouch for this fact that your moods are not the best and you're a little bit more irritable than normal. But exercise can help to elevate your moods and also elevate your energy levels, making you a very sweet and lovable person. Exercise can also help you sleep better. And I have been told this multiple times by my class students because I take classes 2 or 3 times a week regularly, and they always will ask me, why don't you take classes every day of the week? Because the day we have a class, we sleep much better at night. But yeah, maybe they can also do a walking program, right? Weight gain is very normal during pregnancy, but it has to be the right amount. You can't gain extra. If you gain extra, your hormones will again go for a toss and you will have all sorts of pregnancy complications. So exercise can help you to prevent excessive weight gain. And I think the best thing is that if you don't gain excess weight, you'll be able to lose this weight much faster. And post-delivery, you won't have a challenge. So that's a big, big, big advantage. It will help to increase your stamina. It will help to improve your muscle strength. After all, we're going to carry so much extra weight in the 9 months. And then post-delivery, we have to keep carrying the baby around. So we need all the muscles that are possible. It will reduce the incidence of pregnancy complications. As I already told you, affected by hormones, things like gestational diabetes, hypertension, thyroid, all of these can greatly be reduced. Exercise will also help prepare your body for labor and birth. So as I said, we are working on this pelvis. This is where the baby is going to come out from. And this is what we are making a lot more flexible with exercise. So probably it will impact how you experience labor and birth too. And then of course, there is the faster postpartum recovery, not just in terms of weight loss. I mean, that's a big bonus. But it also means that your body is energetic, in good shape. So recovering and bouncing back to normalcy becomes a lot easier. If you don't know what to do, right, the best thing that you can do is start with a walking program. It's safe, it's convenient, it can be done anywhere, and there's no supervision needed at all, right? Because, I mean, how much can somebody supervise you while you're walking? But there are a few things that I would recommend that you take care of. First and foremost, wear comfortable walking shoes. That is something which is really, really essential. You know, most of the times women will just go in their home slippers or sandals and etc. That is not a good idea because you could slip, trip, fall, your feet could get injured. Not a grand idea. Always wear good walking shoes which will support your feet, and it will also take the impact, so your soles of the feet will not hurt. Cotton exercise clothes will ensure that you don't get overheated. So always wear cotton and choose loose clothes. So they are your exercise clothes. So a t-shirt, track pants. Even if you want to wear a salwar suit, wear a cotton loose salwar suit, and that's perfectly all right. Many people end up exercising on an empty stomach. During pregnancy, you should not do that. But it's also not a great idea to eat a big meal and then go for your exercise, go for your walk, right? So eat a small snack, maybe have a fruit, have half a sandwich, maybe a small cup of juice. whatever you have as a quick snack, some nuts, make sure you eat that and then you go for your walk. Always carry a bottle of water, so that is your best friend during pregnancy because it will help you to stay hydrated. Always carry a bottle of water, so drink water before, during, and after. You have to walk at a pace which is comfortable and brisk, right? So I don't want you to be going for a walk where you're just strolling around and you're able to, grab your mobile phone and talk all the time, because what is going to happen is that you are going to focus on the talking and you will not be focusing on the walking. I do not want you to get breathless. So you choose a pace where you can talk, but you don't want to talk, right? So you're not comfortable enough to have like a nice, relaxed conversation with your best friend, but you definitely are focused on your walking. It's a good idea to listen to your body. The main aim is about 30 to 45 minutes every day. So again, listen to your body. If you feel that it's a little bit too much, it's okay. You can, kind of get moving on another day. So if you're feeling tired on a particular day, you can do a little less, that's fine. But if you find that you're feeling tired every day, then that's something that you need to investigate. Maybe your hemoglobin levels are low, maybe you're not sleeping well enough. And that's what I was trying to say, that aim for, a 30 to 45 minutes routine every day. That is something which would be highly recommended. Now I'm going to show you some pictures of exercises which I want you to start doing at home. Again, once you have permission from, your doctor. The first is neck rotations. When we're looking at neck rotations, the neck rotations are basically to ensure circulation to your upper body, the head, which is going to ensure that you do not have any headaches or reduced incidence of spinning of your head or etc. So always do neck rotations, but do them slowly. So it's literally a rotation where you're dropping your chin to your chest, left ear to right shoulder, back of the head to the back, right ear to right shoulder, and you go chin to chest, okay? And the way I did it, really, really slowly, is exactly what you have to do. Always do your exercise slowly. If you do this, then that only is going to cause your head to start spinning, which is not a good idea. Then comes your wrist rotations. Now these are excellent for preventing any kind of edema, swelling during pregnancy. So your finger rings should be fitting you like this all throughout your pregnancy. If your finger rings are not fitting you, either you have swelling, which could be a warning sign, or you probably have excessive weight gain, which is also not a very grand issue, right? So always keep checking this. Sometimes what happens is when we are sleeping at night, our hand is under the bed and all of that, and under our body. And this can also cause a lot of, swelling and fluid retention and all of those aspects too. So keep all these things in mind, and depending on the time of the day, if you feel that, you're getting a lot of swelling in the morning when you wake up, then do it in the morning. Otherwise, you can do it anytime during the day. The same way that we did the wrist rotations, you should also do exercises for your feet. During pregnancy, the uterus is sitting right here in the center. So the blood flow from the legs to the heart is obviously being impeded. It's kind of getting stuck. And therefore, we have to do some kind of, movement for it. And, simply pointing your toes, flexing, pointing, flexing, and then, even doing ankle rotations, that can help the circulation. This can also help you to reduce cramps in the legs and, the little leg cramps that you get at night. However, if after doing this exercise also you are getting cramps in the legs, another thing that has to be investigated is that your fluid intake is optimal. So that is something that you have to be particular about. Yeah. So this is your ankle rotations and your foot flexes. The butterfly position is a very, very good position for pregnancy. So look at it this way, right? This is a normal pelvis. When I'm sitting in a butterfly position, this is what is happening to the pelvis. So the pelvis nicely widens up, it opens up, it kind of creates a lot of space for the baby as well. So it's a good idea to do this as an exercise, and also do this on a regular basis, maybe when you're sitting, when you're talking on the phone, watching television. So you could sit in this position. When you feel tired, you can release your legs, you can bring your legs back again. All of that is really, really doable. But this is something that you should keep in mind as far as doing your butterfly position is concerned. Backache, again, there are exercises for backache as well. So let's talk about the picture on the left first. This is what I call my cat pose, where, you know, we've all seen an angry cat where the back is really arched and the cat is like really, really annoyed. So when we're doing the cat pose, this is the kind of position that we are looking at. So the back is arched, the head is sticking up, and the buttocks are also out. So you get a good stretch in the lower back. When you're doing the cat pose, it is possible that you feel a little bit of stretch in the abdomen region as well. If it is comfortable, go ahead and do it. If at all you find that you're not comfortable with the stretch, then you need not do the cat pose and you can only do the camel pose. So you can see the picture on the right, that's your camel pose, where the back is arched as a hump, and the head is down and the buttocks are now tucked inside. This is another great exercise for the back. And what we are doing is a pelvic tilt. So the mom is lying down flat on her back. Her feet are on the floor. Her hands are next to her buttocks. And now she has slowly lifted herself up, and then she is going to release. So this is something which moms can do on a regular basis. One of the things that I would recommend is whenever you're doing these exercises, always do them on a yoga mat. That is something which is really, really important. All right, so till then, what I'm going to do till Ashutosh gets us the PPT, I'm going to continue talking to you guys, and I will also demonstrate some things physically, so that, we don't lose out on time. So after the walking program, the first thing that I spoke about was the neck rotations. And in neck rotations, what happens is that we are doing this really, really slowly. And it is something which helps to improve circulation to your head. So it will reduce the chances of, headaches, your head spinning, that little dizzy, giddy feeling that is generally associated with pregnancy. So the first thing that we are doing is we are dropping our chin to our chest, left ear to left shoulder, back of the head to the back, right ear to right shoulder, and chin to chest, right? And we're doing it as slowly as that. And then again, we're going down, right, back, left, and it's down again. Okay, so that's how you do neck rotations. Neck rotations can also be used as part of your warm-up and etc. Okay. The second thing I spoke to you about was wrist rotations. And when we are looking at wrist rotations, the idea is that we are doing this, right? So the circulation is coming over here. So we are doing the circles, 1, 2, 3, and 4, and we are reversing the circle, 1, 2, 3, and 4. Okay, so I'm showing you 4 counts for women who work a lot on the computer, or maybe if you have swelling at certain times of the day, you can do this exercise as many more counts. During pregnancy, as I told you, the uterus is gaining in weight. And because of that, it also impedes the blood flow going back to the heart. So the blood flow from the legs to the heart obviously becomes slower and the circulation is stopped. Because of that, we should do some foot exercises. So now imagine these are my feet. And what I'm doing is I'm literally flexing and I'm pointing my feet. So I'm moving my ankles. I will flex and I will point. I will flex and I will point. Another thing that I can do with this is also I could do rotations. So I could go rotations for my ankles, first in one direction and then in the other direction. So this will also ensure that my circulation is improved in my feet and my legs. Butterfly position, in which when you are sitting, the whole idea is that you have to bring your feet together. So you imagine these are your feet, bring your feet together and you're going to keep your knees as low as possible. So imagine that you're bringing your feet in as close to your pelvis as possible. That is something which is really, really important. So bring your feet close to the pelvis. You will feel a great stretch in the inner thigh. What this is doing is, it is helping to widen out your pelvis a lot like this, right? I would recommend that you sit in the butterfly position as many times during the day as possible. So you can also sit, while you are, talking on the phone, watching television. You should sit in the butterfly position. This is a great exercise for you. If you are doing it as an exercise, there are various ways that you can do it. So you can flap your feet like these, the knees up and down, or you can also do it really rapidly, the way a butterfly flaps the wings. So you can do this as a position as well.
Sonali?
Yes, ma'am.
Hello, Sonali?
Yes, ma'am.
Can you show some exercises where many a woman complains of pain and cramps in the legs at night while sleeping?
Yes.
Okay,
Yes.
so can you tell something about that so that it's comfortable at night?
Right. So I am going into, I think Ashutosh has managed to get my slides up. Yeah, that's the butterfly. So when I'm sitting like this, I am talking about bringing my feet as close to the pelvis as possible and my knees as low as possible. So I would, if I was wearing track pants, I would be able to put my knees down completely. But since I'm not wearing track pants, this is something which we'll have to adjust with, but make sure that they are as low. So it can go up and it can go down. And this is your exercise position. As ma'am said, for the cramps in the legs, the previous slide was there where you have your legs straight, you're pointing and you're flexing. You're pointing and you're flexing. Previous slide, Ashutosh. So it's flex and point. And then you have your rotations. So you have your ankle rotations. So this is excellent for your, calves.
So you can make it a point that every night before going to sleep, when they are going to bed, while sitting on the bed, do this as a routine and then sleep. Yeah.
Absolutely.
So if you distribute the exercises throughout the day, then it becomes easier. Yeah. So while in the kitchen, they can do something, standing on the toes, and before going to sleep, this one. As you told that before, while seeing the television, they can sit in a butterfly position and do the butterflies. So like that. Thank you. Please proceed.
All right, Ashutosh, get me the next slide. This is the cat and camel pose. Now that I'm on the floor, let's just stay on the floor. The cat pose. Yeah, just stay there. Okay, so now just watch what I'm doing. I start my position absolutely flat. And then the next thing I'm going to do is I'm going to arch my back. I'm going to look up at the ceiling, right? And then I'm going to round my back out. And I'm going to look down at my navel. So it's an arch. And it's a round. So that's the kind of position that is going to really help you with your back pain. All right. The next slide is your pelvic tilt. I'm sorry, I did not even get a chance to remove my mat, so I'm just going to be on the floor. So we're lying down, absolutely flat. The feet are on the floor and the knees are pointed towards the ceiling. I place my hands near my buttocks and I'm going to raise my hips like this off the floor. And I can hold it here for 4 counts. And then I can slowly release it. So if you notice, everything that I'm doing is really slowly. I'm not doing anything in a rush. Okay? So place my hands here. That's my support. I slowly raise my buttocks off the floor. So you can see how much distance has been created. Right? I can hold it there. 4, 3, 2, 1. And slowly release. So you can do this a few times. This is also excellent for your back. Ashutosh, we can have the next slide. All right. So now this is a great exercise for a lot of reasons. Okay. First, let me demonstrate it to you, and then I'll show you, talk to you about the advantages. So when I'm lying down, my body is in a straight line, and my lower leg is folded. My upper leg is going to go up, and it's going to go down to 90 degrees. So what I'm doing here is I'm actually opening out my pelvis. So my pelvis is going to get a good exercise and a good stretch. And another thing that this will also do is it will help to reduce any swelling that is there in the feet and the legs. Because now when the foot is elevated, all the blood flow is going to go back towards the heart. So edema and swelling is not going to be something which is prominent in the legs. So this is also something which can be done in the evening hours. If you've been up and about, standing for a long time, I would ideally say start with about 8 counts for each leg, and then you can slowly increase the number of counts. Next slide, please. All right. Then you have your pregnancy squat. What I would recommend is take the support of a good chair and don't lean on it. Spread your legs really wide and then slowly squat down. Okay. So let me show you how that is to be done. Okay, so just watch, forget about my head getting cut off. So legs are really wide apart. Imagine that we have a chair, toes are pointing out, and we're going down, and we're going up. When you come back up, make sure that your knees are nice and soft, and you go down again, and you can come up. And then you can go down, and you can come up. Right? So these are some things that you can incorporate in your daily routine as far as pregnancy is concerned and make it a mix and match. So you don't really need to, sorry, I'm back. You don't really need to kind of, think that you have to do all of them in a go. Even if you're doing 15, 20 minutes of different things at different times of the day, it's perfectly all right, and you don't have to accomplish a lot. So many times I tell moms that please find only 10 minutes in a day, which is going to be really, really helpful for you more than anything else. Rather than saying I'm doing 45 minutes, 1 hour, 10 minutes of prenatal exercise and 30 minutes of walking, and you're probably done as far as your preparation for pregnancy is concerned. Now let's get into the 4th trimester. The 4th trimester is where we are talking about post-delivery. The most important thing is that you have to eat a healthy diet. Don't avoid foods. Don't eat excess of any foods. Many times we have mothers eating a lot of ghee, a lot of, fatty and sugary foods. So that is not something which is recommended. You should eat a balanced diet. Your body needs to recover. So you definitely should not go on a crash diet. I mean, I know it looks like, oh my God, I have to lose so much weight and all of that. Don't worry about that. That's not something which is important. Weight loss has to be gradual. So on an average, it's taken you 9 months to gain all this pregnancy weight and grow the baby. So you have to give yourselves at least 6 months of a normal, healthy lifestyle to reduce that weight for the slow and gradual weight loss. Okay, next slide. In a vaginal birth, you can start some exercises at about 6 weeks. But this will really depend on your recovery, on how you're feeling, right? So the best thing that you can start is obviously a walking program. And in the cesarean section, we recommend starting exercises properly at about 3 months. Okay? Listen to your body. Don't overdo anything. Don't stress yourself out. There are times that the baby is going to be fussy, the baby is not going to sleep well at night and all of that. So if that is something that is happening, then you can take it easy on a particular day. Yeah. Next slide. The first thing that one must check post-delivery is for diastasis recti. So if you see the slide on the left, it is showing the picture on the left, it is showing the internal abdominal muscles. The first image there is of a woman who has a normal abdominal muscle wall. That means her muscles are nicely joined like this. The second picture is of the woman whose abdominal muscles have separated. Because of pregnancy, it's normal. The uterus has grown so much that it is going to end up causing this kind of, all right. So yeah, we were talking about diastasis recti, and in the second image, because of the growth of the uterus, the abdominal muscles are separated. And if you see the picture on the right, I have shown you a woman who has a little pooch. You know, her stomach is a little protruding. So even after months of having a delivery, the stomach doesn't go inside. And many women start wondering what is happening and why and etc. So that is why this becomes a problem. So at about 6 weeks post-delivery, your abdominal muscles should be checked. And I'm going to show you how. Yeah, so here's your next slide where, you lie down flat on the floor. You're absolutely flat. So you have your feet on the floor and you have your knees pointing upwards. And you kind of, press into your abdomen, just at your navel. So you press there, see what you're feeling. Then the next position that you will do is you will put your hand behind your head as if you were trying to do a crunch or a sit-up and raise yourself up. And then again press around the navel. See whether you can put, how many fingers you can put. If you can put one and maybe just a little more, then you have normal abdominal muscles. But if you can put 2 and more fingers into that gap, then you still have diastasis recti, and you need to do some special exercises for that before you can start a normal exercise routine. What is really essential is that you have to, and if you are, I can't do this, I can't check, how can I be sure, and etc. You can ask your doctor to also check for you. And then once the doctor says that, okay, your abdominal muscles have settled down, you can start doing all sorts of exercise routines. Next slide, please. So this is the first exercise. The first exercise that we are asking you to do is literally lie on the floor, and we are doing cycling. So what we're doing is we're cycling, but we are not, keeping our feet completely above the ground. So you will first tap one toe to the ground, bring it back up, tap the other toe to the ground, bring it back up, and keep tapping your feet like this to the ground. So you can start doing this exercise in a vaginal birth after your vaginal stitches have healed, and you can start doing this post a C-section at around maybe 6 to 8 weeks. So if you feel that the diastasis has not settled down, then you can start doing these exercises at that point of time. Next slide, please. So then this is leg slides, which is also very, very good to help you to heal your diastasis. So you're again lying in the same position, and you can slide your leg forward and back and forward and back. So this is a full slide as compared to the previous one, which was just like a toe touch. There are many, many more exercises that can be done, but it is always good to focus on 2 or 3 exercises because it does not take long. The body does recover on its own very well. But this is just to help things along. Next slide, please. So this is going to actually bring me to the end of all the various slides that I put together for you. As you know, as I told you right in the very beginning, this session is being brought to you by Cordlife. And Cordlife team will be getting in touch with each and every one of you after the session in the next 24 to 48 hours. They will share the recording of the session for whatever it is worth. I don't know how many times it went on and off, but any which ways, they will share that with you. They will also share a coupon which is being sponsored by Bumberry. Bumberry is an eco-friendly diaper. So we have cloth diapers which you can wash and reuse. So a lot of parents would like to use cloth and they don't want to use the disposables. So this is a great option for you to try an eco-friendly diaper. So make sure you take that call, and if you choose to take a presentation with them, they will also be providing you with an online class which is run by me. I'm now open to questions, and I've also put my Instagram, Facebook, and YouTube handle, all the IDs on the screen. So make a note, and yes, we can stay in touch through all these areas as well. So I'm going to open up the questions, and we can answer them for you. And Dr. Ratnabali is also with us, so she can also help me in, dealing with a lot of the questions.
Ashutosh, is there any question that has been put?
Yeah, there are lots of questions.
Yeah.
So the first question is how much water we should drink in a day. So the idea is that you have to drink about, 8 to 10 glasses. So about 2 to 2.5 liters of water on a daily basis. If you're exercising, if you feel that, you are doing a little bit more strenuous work, then you can have a little extra water there as well. The next statement that has come from Pooja is after...
Can I just add one thing, Sonali?
Yes.
Yeah. What the easiest way is to look at the color of your urine. The color of your urine should be almost like the color of the water you are drinking. Maybe a bit, yellowish. Maybe. So if it is so, you are drinking enough water. If the urine becomes yellow, orange, or darker, then you are not having enough water. This is easiest way to find out how much water. So if it is becoming more yellowish, they may take more water. If it is becoming more clear, fine, you are doing well.
Great. Wonderful. That's a wonderful tip. Thank you so much, ma'am. I have another question. After small duration of kitchen work, my heels burn, and they burn severely. What should I do?
Sonali, is there anything that you can say?
Heels burning, that's a little, odd. I can understand that your heels are paining. So one thing I would suggest is, don't stand for a very long time. While something is cooking, you can sit down. Make sure your slippers are comfortable. So, get something which is soft soled and not the simple flip-flops. So having a comfortable pair of slippers will definitely help. What I also teach mothers many times is you can keep a bottle, literally like this, right? Keep a bottle on the floor and you can place both your feet on it and slide the bottle back and forth using your feet. So that will help to give a little massage to your feet, and that is something which can be helpful. But burning is, I'm really confused. There's a pain I can understand, but...
Sonali, burning may be a symptom of some disease. So I don't think that during pregnancy anybody is having disease. Pregnancy is a normal situation. Sometimes vitamin B12 causes some burning sensation in the hands and feet. So if it is so, you can take vitamin B12 capsules. This is a vitamin, so nothing to be worried about. Whenever you tell your doctor you are having burning, they will definitely give you vitamin B12. That's the treatment. And apart from that, sometimes this burning sensation may be the very precursor of the nerve compression at the level of the, lumbar spine, L4, L5, like that, S1. So that is much more serious thing, and therefore I am not considering that. So let's follow what Sonali was telling, doing exercises, putting this water bottle below the feet and doing that, and you can have vitamin B12 tablet after asking your doctor.
Right. I am 20 weeks pregnant and I have pressure in the vaginal area. What should I do?
Yeah, that you should have. It means you are pregnant. something is pressing. So there is a baby in your womb, and the womb is placed in your pelvis, just in between your urinary bladder and the rectum behind. And there are bones that Sonali have shown you physically. Sonali, can you show the pelvis? Can you show the
Right.
pelvis you're having, bony pelvis? So this the bone, you can show the symphysis pubis. So symphysis pubis you can show with the finger, the joint. And the joint is very, it's a cartilaginous. So whenever you are pregnant, the hormones, progesterone and relaxin are acting over there. It is becoming soft and it moves. In fact, in the X-ray previously it was shown that they rub against each other. So you will feel something pressing on that, and that's the way how nature expands the pelvic cavity so that the gateway becomes more big and the baby can pass through it when the real time comes for the delivery. So you have to bear with it and take it in a very positive sense. Okay, my gateway is opening up for the baby to come out.
Right. Wonderful. All right. There is a mother who's saying that she has not been exercising so far, but now she wants to start regularly. Ma'am, I've already suggested that you should start slowly. Don't start with too many counts. Listen to your body. So follow all of those instructions. It's okay. You can start in the third trimester if your doctor gives you the green signal. Ma'am, there's a question for you. I am worried that I'm not getting enough sunlight as due to corona we are inside. Will it affect my baby even though my doctor has given me D3 supplements?
Yeah, actually, we are worried about vitamin D3 levels in Indian population, where almost 95% are deficient. And vitamin D3 has got function throughout our body, especially in the pregnant state. You need it for the building of the bones, calcium deposition in the bone of the baby. So if you are taking vitamin D3, not to worry about sunlight not giving you D3, but try to be exposed. I hope there is some balcony at your home. So from 10:30 for an hour, if you go over there and read your newspaper, exposing 25% of your body surface. So if you wear a low back blouse or whatever, top, so and you're from the neck till your waist, only covering a very small part on the back, that is 25% of your body part. And use something, wear something that is sleeveless, so both of your hands are exposed. It is enough for 1 hour from 10:30, in the balcony to stand with the back outside. It's enough. So your face will not be burned. That is the tip.
Yes, absolutely. So a lot of times mothers ask me this question. And so D3 is basically skin exposure. So if you are comfortable with even wearing maybe something like a skirt or something, that can also help your legs to be visible. So whatever you're comfortable with in terms of clothes, the more the skin exposure is what is going to help you with your D3 from the sun. So yes, wrist rotations, ma'am, you can do if there is slight pain also, because that's the whole idea. If there is edema, there is swelling over here, the wrist might feel painful. So the whole idea of making you do wrist rotations is that, the pain is reduced. So I have a lot of messages from everybody that, the slides are going, and I really don't know why. Since the coronavirus started, ma'am, I've been doing webinars, and somehow today all the glitches have happened. My screen is not visible. My electricity is gone. I still don't have electricity at home. It's been one day.
It doesn't matter. We can spend one more day. You can find out the whatever very important, and we can just push it into another presentation next day. So
yeah,
don't get disheartened. We can do it again.
I know. Ashutosh has recorded this for you. So that is going to be shared with everybody. And I've completed it. So whatever the mothers feel, and I'm also available to answer questions. Ma'am, they want to know if they can have green tea during pregnancy.
Yeah, why not? It's not a problem. Yeah. You can have any damn thing you like, because you are a human being and pregnancy is a normal situation. So have everything in a proportion. Don't go on having green tea 12 times a day, but once or twice a day is fine.
Yes, so green tea also has caffeine. So don't overdo it. 1 or 2 cups a day is okay. But then be careful of the other caffeine products that you're having. So if you're going to have 2 cups of green tea and 2 cups of regular tea and 2 cups of coffee, then you're going to do overdo. So think about the component that it's caffeine. Yeah, and we don't want to increase your overall caffeine intake. So if you're having 1 or 2 cups of only green tea, then that's just fine. However, if you're thinking that you're having green tea because you want to lose weight, that's not a good idea, because that's not really going to get achieved. Also, green tea that you choose, just make sure that you pick up something which has got all the ingredients listed nicely. You know, the regular green teas which are available. There are lots of herbal fancy options which are there, and we don't know what is there in those. Yeah. So how it impact the pregnancy, we don't know. So always pick the standard green teas, the ones which are available in the grocery stores, where you know that the ingredients are known to you. Okay, the abdominal belt post-delivery. So as I showed you, you know, the abdominal muscles separate. Whenever you're in an upright position, when you wear the belt, it will help to support the muscles. So that is the reason to wear the abdominal belt. It is not making your stomach flatter. So don't wear the belt because of that. For pre-pregnancy planning, I think you should meet your doctor, gynecologist, because preconception counseling is very important, and both you and your husband should go together. That's the question on preconception they are asking. Stretch marks. Ma'am, you want to say something about stretch marks?
Yeah, stretch marks, actually nowadays fancifully we say it's the drawing of your first drawing of your baby on your tummy. So don't get so harassed with it. However, stretch marks are called, if you look at any elastic, for example, in your undergarment, there are elastic bands, and when it is you are using for a long time and overstretching it, it becomes loose, and that can never come back to its own shape. Similarly, under the skin, we have got some tissues, we call collagen tissues and elastic tissues, which when they are overstretched, not only during pregnancy, if you're suddenly becoming very fat, they are overstretched. So in that situation, they break. Like the elastic tissues in our bra or a panty, similarly they break, and they will never come back to its original situation. So when they break, on the skin above it will become red, and sometimes they are itchy, sometimes a bit painful, and it shows that the hygiene, the health of your collagen and elastic tissues are not very good. The protein content is less, and they are dehydrated. The only thing we can do at that point of time when you get pregnant, when you just jump into the second trimester, we can ask you to hydrate your skin of the abdomen. So after you take your bath, when it is still moist, you can apply some, sort of a moisturizer, a chemical. We can hold water. That's all. Because once you wear your dress and with the air, the water is lost. So by that, we sometimes give you something to use. Not always it works, but hopefully it decreases the chances of, this breaking of your collagen tissues and elastic tissues. However, after 6 months of the baby is born, this pink color and red color, also crazy looking scars, they go off and they become very small, linear, and they become a silvery in color. So it's not that always they can be seen unless you go to a sea beach and wear a bikini. And so it's not something very great. People get very frustrated.
We can be proud. Yeah, we can be proud of the fact that we are pregnant. Yeah, definitely.
If you keep it hydrated, your abdomen, that's many a time you prevent.
Right. So I have a mother who's saying, when I work in the kitchen, because of the stove heat, my tummy gets really hot. Does that affect the baby?
Not at all, because the baby is floating in a water, and it has got a great power to regulate everything, not only temperature, but its acidity, alkalinity, its concentration, all food, everything is in that fluid where the baby floats. So even if you are getting to Antarctica and it is a minus 60 degrees, that also won't matter if it is heated up in a kitchen. You will feel uncomfortable, definitely, because your skin, the blood vessels are, becoming, due to the heat, they're becoming more bigger in size, more circulation. You will feel uncomfortable, but the baby won't feel it.
Right. But one thing that we do suggest is that, if you are a member of a gym or anything, of course, now they're all closed, but don't go into a sauna or a steam room,
Yeah,
because
yeah.
if your body temperature rises beyond a particular point, then the womb temperature will also rise. So that is not something which is
So
positive for the...
what we suggest is when your body temperature due to circulation throughout the body rises, the blood
Yeah.
circulates more on the skin. So the baby
Right.
will get less of a blood, and that is not good for the baby. So sauna
Right.
is never, suggested. And also we won't suggest to cook in the our what we call it, microwave.
Hot. Oh,
So
okay. Yeah.
so
Yeah.
we do not know the effect of microwave on the baby in the tummy. So better, and it is always placed at the level of the abdomen. So better to avoid
Right.
it.
Right. Okay, I am 27 weeks pregnant. I exercise regularly, but I still feel stiffness on my joints, hands and legs. I think the main thing that you can do, ma'am, over here is exercise, keep stretching, see at what point and what conditions you're feeling the stiffness, and see if you can avoid that. Sometimes when you're sitting for a long time, then that can also cause stiffness. So always keep moving around. I have a mother who wants to know the best way to sleep at night and the perfect side to sleep at night. Ma'am, do you want to answer that for her?
Sorry, I just missed it. Can you
Yeah,
repeat the question?
the best way to sleep at night.
Wow. So there are a lot of myths and misconceptions that you should sleep only on the left side. So somebody feels throughout the pregnancy sleeping on left side. The basic concept is the blood vessel which supplies the blood to the womb. It's on the left side. So sorry, it's on the right side. So if you sleep on the right side, it is being pressed and less blood flows to the baby. So it is said that when you lie on the left side, the blood circulation to these big vessels to the uterus is better. So this is the only concept. Otherwise, if you sleep on the left side or right side or upturn, doesn't matter at all. So it's better that whenever you are conscious, you lie on the left side, then automatically when you are sleeping, you return to right, you are turning. Again, you are, waking up at midnight, going to toilet, again start with the left side. Then you are, but it's not that you have to put alarm and see every hour whether you are on the left side or not. Somebody does that. So
And your
it's not,
husband also doesn't need to wake you up in the middle of the night to tell you you're sleeping on the right, turn over on your left.
yeah.
Yeah. Yeah, I've had this, ma'am. A lot of times mothers will come very annoyed that my husband woke me up because I was sleeping on my back, and then he turned around and went to sleep and I couldn't fall asleep again. So that's a big complaint, so they don't need to do that. Cramps have already spoken about this in one of the things, that you need to drink plenty of water, and I've shown you exercises for the cramps. Third month of pregnancy, I would not recommend you start the exercises yet, because you still don't have a detailed ultrasound. Once you get that and your doctor gives you the permission, then you can start doing all the exercises. My third trimester is going to start, and I work 9 to 10 hours and I sit in one chair. Is it safe for the baby?
It's unsafe for you.
Yeah,
Because
you should not
once you are sitting, your blood circulation to the legs are, in a stagnant situation. You might develop the venous thrombosis, which is dangerous and life-threatening in pregnancy. Apart from any pains and aches that I am not dealing, that Sonali will tell you, but what I am worried about, like when you are flying, we say every hour you just stand up and you walk in the plane, aeroplane. You do some leg exercises, which is shown on the when you are doing an international flight, and drink a lot of water. But when you are at home, who is preventing you from doing that? So even if you are online, you do some exercises on the legs, and whenever you get some time, 5 minutes, you just stand up and walk in the room. So you have to do that. It's not the baby, but your health is your paradise.
Right. So any which ways during pregnancy, I think you need to go to the bathroom every, 1 hour or so. So that is also a good movement. You should get up, go to the bathroom. So keep drinking a lot of water. Don't think that if I have water, I will need to urinate. So I don't want to go to the bathroom. So drink water, go to the bathroom. Also keep moving your hands and legs. And whenever you get up, or even if you're sitting in one place, you can, just stretch your hands up, do some shoulder rotation. So keep involving some movement or the other in your entire process. All right. So I think that was the last question, ma'am. All the questions have been answered. Thank you very much, audience. Thank you, ma'am, for joining us and sharing your valuable time and insights and patiently answering all the questions. I think that was really, really awesome.
Thank you, Sonali. Thank you, Ashutosh. And all the participants, though we can't see you, but feel that you were listening to us, and it's like a family. We are earlier. Usually, there are a lot of family members who used to give you advices. The mother-in-law, the sister-in-laws, the great-grandmother, like that. So now we are taking their place because now it's a nuclear family, and due to COVID, also people are becoming more and more nuclear. So it is maintained the academic.
I'm looking like a grandmother just yet.
Yeah. Okay. But anyway, thank you. Meet again. Yeah. Hope to meet
Absolutely.
again.
Thank you so much, ma'am. Thank you, everybody. Thank you, moms, and hope you've learned a lot today. We will be definitely sharing this detail with you, and Cordlife team will be in touch for the same. Thank you.